and go live. All right. All right. Good evening, everyone. This is Stephanie Coleman. I am the Autism and Family Educator with Kansas LEND. If you don't know what LEND stands for, LEND is Leadership Education in Neurodevelopmental and Related Disabilities. We are housed at the Division of Developmental and Behavioral Pediatrics at the University of Kansas Medical Center in Kansas City. Kansas LEND is a workforce training grant where we work with many different graduate disciplines in the clinical space, along with family and self-advocates, to work together to learn to become a team to be able to work for individuals in the future on how best to support individuals with IDD. Tonight's session is the missing link, leveraging nutrition and developmental disabilities, with Breta Alstrom. She is a past LEND trainee, which I know she's going to share that in a minute anyways, but I'm going to spoil that fun for her. So with nothing else, I'm going to turn it over to Breta.
So, well, thanks for having me. I'm excited to dive in. We'll just go ahead and get started. So I'm Breta. I'm actually a pediatric dietitian. So I have a master's in clinical nutrition from KU Med. As Stephanie said, I was a previous LEND trainee, and I also have a certificate in integrative and functional medicine. So we're going to kind of weave that into our conversation today. I specialize in autism outside of just like the kind of broader developmental disability space. I mostly work with kids with autism, and then other kids that have developmental disabilities. They're just not as big of a piece of my caseload. Previously, I was a pediatric dietitian at Children's Hospital of Colorado, and I have a private practice that is virtual right now and is kind of in all 50 states, and it's called Nourished Together. And then I also do contract work and really like kind of hone in my integrative and functional medicine skills with a health optimization startup called Optimal Human Health. So I do a couple different things, but I think it all kind of helps me serve my families better that I work with. So today we're going to be talking about really what's the importance of nutrition. Is it included in your either your family member or your client? Is it included in their care? Should it be included in their care? And then like, what are some signs that you can recognize to then use that to better support the people in your life that have developmental disabilities? Oh, and you guys can go ahead and ask questions throughout, and Stephanie will just stop me and let me know what they are. We're going to go through like a couple different sections, so that's kind of the easiest. And then there will still be time at the end for like broader Q&A because we're talking about such like a big topic, and there's not necessarily a specific disability. We have family members, we have case managers, we have like healthcare providers in the works. It's really hard to hone in on like one really specific kind of nutrition topic and go in the weeds. So if you have additional questions at the end, that'd be the time to ask those things. So first, I just want to say that disabilities don't need to be cured, but everyone does deserve access to appropriate care, and they deserve to have a choice in how they live their life. So as I go through my work, I typically have people who, you know, they want to dive in really deep. They want to get a lot of different labs. They want to really learn how to optimize their child's life or family member's life. But then I have other families that they don't want that. Maybe they struggle with like picky eating, and they would just love for their child to eat a different kind of chicken nugget. And that is also fine. So it's really family centered, and we're going to dive in a little bit deeper in that later in the presentation. So I think a really big piece of confusion for people is like, what does a dietitian really do? And this is because it varies based on the dietitian that you work with, maybe the place that you are seen by a dietitian, the specialty, what your nutrition concerns are. So that really varies, but at its core, they're going to focus on the nutrition care process, which might be a little bit different than, you know, if you're going in to see another kind of healthcare provider. So they're going to dive in really, really deep into, exactly what you're eating. And at the end of the day, help you develop strategies to get to an outcome that you've decided that you want to, promote health related to food or nutrition. I think the biggest difference when you're working with a dietitian is the follow-up. So I get to meet with my clients once a month, every single month, which is a lot different than a lot of other providers you might meet with. You might see your doctor every 6 months or every 3 months, even for someone who has a pretty complex condition. But I'll meet with people as frequently as like every single week. So there's a lot of that follow-up, and that kind of what falls under here, this monitoring and evaluation, where we're really looking into, okay, what worked for you, what didn't, what improved, what didn't, and then we kind of recraft our plan, and then we start the whole process over. So it's kind of like continually going through this process and really trying to figure out what is going to be optimal for you. And when I say you in this conversation, we're talking about the people who have developmental disabilities, and then also you is in like the greater context of your family and what works for the entire family, and not just the kiddo or the family member with the developmental disability. One of my favorite quotes is from a Paralympic skier named Bonnie St. John. She said, "Food isn't medicine, food is life." And I think that this is really foundational. Like, why do we need to focus on nutrition? I would ask you, like, if you've ever worked with a dietitian or tried to incorporate nutrition into your life, or if the people on your caseload, if they are meeting with a dietitian, is that a conversation that they've had? Like, why is that the missing therapy? So that's why we're diving into nutrition as being the missing link, because most people just aren't getting nutrition care or nutrition services right now. So why nutrition? We're going to break down all the different reasons you might need to see a dietitian, but honestly, food is just core. You can't do anything if you're undernourished. And so food is so much more than just calories. A lot of times, people do need extra calories or more energy, or maybe they need fewer, but we also need to look at kind of these components of food. So those would be our macronutrients. So protein, carbs, and fats. Having the right ratio of those can also make a huge difference in kids' therapies that they're getting. I have a lot of kids that when they start to see me, then they excel in their like speech therapy, they excel in their OT and their PT, because now they have the energy and the nutrients that they need to be able to complete the tasks and really make it through therapy on their own. So it can support people in like, yes, we want to make you healthy, but also helps you execute other goals that you're working towards. And then kind of that final piece of nutrition is we have our micronutrients, which is vitamins and minerals, and making sure that those are optimal and we're not missing anything, because we can add on additional health concerns if we're lacking some of those items. So nutrition is really connected to everything. There's a lot of different branches to nutrition. It gets really complex, but at the end of the day, it's just that really foundational piece in anything related to health and wellness. So nutrition can impact the way your genes are expressed, and like what gets turned on and what gets turned off. And with that genetic expression, that's related to disease risk a lot of times. Nutrition impacts that gut-brain axis. So things like anxiety and depression, and really like brain fog and all those different kinds of things. IBS is like a really good example of something that would be impacted by the gut-brain axis. It goes both ways. So what you put in your gut can impact kind of that brain response. But in the case of something like IBS, we also might have, this brain response where we're extra stressed, and then that's stimulating the gut and we're getting adverse side effects. So it's a two-way street there that we really want to make sure is kind of nailed down. And a lot of people with disabilities end up having some altered GI function that we want to make sure is optimized, that it's not impacting their quality of life. And then detox is also really important. Just our world is very toxic, regardless of like how clean you try and make it. And so we want to make sure that our body is functioning at its best, even with all of these kind of toxins bombarding us all day long. And the easiest thing is it's not anything super special. We just want to make sure your liver is supported, and we want to make sure that your liver health is great. And that is through food and nutrition is a super simple way to do that. And as we look at, all of our body systems and how they interact with each other, nutrients are really the currency. Nothing in your body happens without a nutrient kind of attached to it. So if you're lacking in something, you're not going to be producing the right things, and those things aren't going to be able to do their jobs in your body. So neurotransmitters, making serotonin doesn't happen, sending those things, throughout your body from your brain to the places they need to go. Those things just don't happen as well when you're undernourished. And the same thing with energy. We need to make sure that we're getting enough food to have enough energy to complete our tasks, so that we need to make sure that we have enough food and enough energy so that our body can do its basic jobs. So adding undernutrition on top of having another health concern is really just adding insult to injury, and we want to prevent that. I do focus in autism, so this little chart on the side, those are some other ways that nutrition is kind of directly related to autism, and things that you can do to not necessarily improve autism. That wouldn't be the right way to think about it, but the way that food and nutrition can impact some symptoms associated with autism. Awesome. So we have kind of two thought processes on nutrition care, and they do tend to have a little bit of overlap, and it's definitely a spectrum of nutrition care, but depending on what you're looking for and what your goals are might kind of inform, which kind of direction you want to go, or what you want to lean into a little bit more. So we have more of like a conventional model of nutrition care, and you're going to find this in hospitals, clinics, pretty much just overall like healthy lifestyle, healthy living. And those are going to be the tips and techniques that people that operate in more of like this conventional space give you. You're also going to get a lot more conventional nutrition, which is totally fine. If you have some like major health concern, if you have heart disease, if you have kidney disease, if you have liver disease, all of those things, we really want to like lean into that traditional care model and make sure that we're safe and we're taking appropriate medical management to those things. Conventional nutrition care is also way more accessible. You can typically, your insurance will probably cover that for you, especially if you're on a state or federal insurance that will definitely cover nutrition care. And then when we switch over to integrative kind of nutrition, we're really looking at the root cause of something. So, if we're having anxiety and depression and all these other health concerns that are associated with those things, then we can dive in a lot deeper and look at, hey, what's causing these things, and really kind of pull things apart really slowly. You might have a lot more time with someone who is in integrative and functional medicine, because typically you'll only find these people in private practice. It's a little harder to find someone who works in like a traditional clinical setting here, which also means it's a lot less accessible, and they probably don't take insurance. That's just kind of the way that it goes. A lot of the things that are provided to you in an integrative and functional medicine setting are just not billable, even if someone would like to take insurance for that. And you can also get a lot more extensive testing, which can be good and can be bad. And it really just depends on what your goal is and what the family's goal is as well. So I think autism is a really good example of this. Like, a lot of people want to dive into the root cause and try and, really improve quality of life and look at those things. And a lot of people tend to go in the integrative and functional medicine direction. Whereas, there are other families who have kids with autism that they're like, no, I just want to make sure that they're healthy and that they're growing and that I'm giving them everything that they need, and they have a wide variety in their diet, and then we're good. And both of those things are fine. It just depends on, which direction you want to go. And I think that information is helpful, even if you're a healthcare provider, so you know what the family is looking for and what direction you can guide them, and helping them work through that process of picking their nutrition care practitioner.
Hey, Breta, this is Stephanie, and I have a quick question. You mentioned insurance and that insurance doesn't cover it. However, this, just from what you've said so far, has been really, the gut health and being healthy so that they'll have the energy to want to go and do all these other things. And so why doesn't insurance take this? why won't insurance cover, I should say, insurance cover your services? And is there something being done more on a national level to find a way to make that happen?
Yeah, so it depends on the kind of service. So if you're wanting a dietitian to help you with like some sort of really specific nutrition related disease or even preventive nutrition. So if you're kind of operating on more of this like conventional side of things, insurance will generally cover that. So those are things that you could go see like an outpatient dietitian for diabetes, for like heart disease and preventive heart clinic and things like that. And your insurance would generally cover that. Even some insurance companies cover, weight loss counseling as well. So those would be and that kind of coverage is that there is a national push for, expanded, we call it medical nutrition therapy, and expanded access for people to have medical nutrition therapy across a wider variety of conditions. So that is something that is being done and always being advocated for on like a national level by dietitians. When we get into the integrative and functional medicine side of things, it's a little bit trickier only because you're looking at something so broad and the solutions aren't necessarily, they're evidence-based, but they're not considered the standard of care. So we have that traditional standard of care that insurance wants to reimburse. And so once we go outside of that to things that might be a little bit more like newer therapies or looking a little bit deeper at things, that's not necessarily recognized by insurance companies on even things that are treatments, if that makes sense.
Yeah, I just, and I know I'm preaching to the choir when I talk to you about this. We've had many discussions over the years, but when we talk about the root cause, and when you talk about the root cause of anything else in medical, like psychology or something else, that gets paid for, the root cause of what the behavioral problem is. So why wouldn't it be a root cause of what the, from a nutrition standpoint too? So that's kind of frustrating.
It is. The other kind of piece of that as well is that if a child or a client needs some sort of nutrition-based formula, it's also incredibly challenging to get insurance to pay for that, even though it would be therapeutic and they'll have a therapeutic use. Even for kids that have G-tubes, it can be a challenge to get it covered sometimes. So when that's something that they need, or if they need a specialized formula that's hypoallergenic, and those cost like $50 a can for a formula, then that's not covered by insurance and you have to pay out of pocket for that. So
yeah, and individuals with disabilities don't usually have that kind of money. So there were two messages or two questions in the chat box, so I'm going to ask them. One is, it says like SAD is recognized, but LCHF is not as accepted. I don't know what that actually means.
Oh yeah, so standard, I'll see if I'm getting this right, but the standard American diet, so it's called the SAD diet, and then LCHF, low carb, high fat diets would be, and those can be tools, yes. So it is frustrating that it's, we have this just general like kind of crummy diet, and anybody who wants to fix it, it's like, and then we have our standard nutrition recommendations as well, which might end up being too high in carbs for some person, just if you're going off like the national guidelines, and they might need a higher fat, lower carb diet to really like based on their medical condition. So it's hard. And then a lot of times people are criticized for that as well. Even as nutrition professionals, a lot of dietitians have their own kind of take and how they want to provide nutrition information. So if there's a particular diet you want to be counseled on and to see if it's a good fit for you, that's also important to take into your recommendation or into consideration when trying to find a dietitian to work with, and making sure that they're comfortable with counseling on that particular diet as well. And we'll talk about that. I have a whole slide on kind of what to be prepared for and how to go into your nutrition visits.
So the next question, is there a way, and this is something I would do, so is there a way to sneak or disguise some of the more integrative things into a conventional sessions?
Yes. So as long as you're comfortable being an advocate for your child or your client, then yes. So some of those things, like a lot of my clients, because I don't take insurance and I want them to have things that are as accessible as possible for them. But like stool testing would be one thing where I can order stool testing and they can pay out of pocket for it. Or if they're already working with like a GI specialist, they can raise that question to their GI specialist and see if they would order the stool testing, and then it would be covered by insurance. Well, depending on your plan, that's always like the little caveat there, to kind of work through some of those things. And then it also depends on your nutrition provider. So I actually see kids in a virtual clinic at Salina Regional Health Center, and they do bill insurance for that. And I get to see kids in pretty much and we do take an integrative and functional medicine approach to families that are interested in that. The only thing that families have to pay out of pocket for is the additional testing. So like I can recommend to them potential supplements they might want to try and different things like that. But if you want additional testing and from me and not from like an additional specialist, then that's like what gets paid out of pocket.
Okay, great. Thanks. Okay, that's it for now. Oh, wait. Oh, no. Just somebody saying hi, Breta. Candace is saying hi to Breta.
Hey, Candace.
So
awesome. So just to go in a little bit deeper on what is integrative and functional medicine, pretty much we have our IFM tree, and all the things and symptoms and disease that you're experiencing happen above. They're those things that we can see and they're manifesting. But what's the root cause of that is what's that underlying stuff. So is it genetics? Is it nutritional deficiencies? Is it lack of sleep? And really diving deeper into why you're having these symptoms. So just to kind of put that into perspective, because I think IFM gets misunderstood a lot of times. And you also have a lot of people that kind of pitch a lot of things under the umbrella of IFM, and those may or may not be right for you and your family. A little bit more here. So when we're looking at this like whole person approach, we want to take into account not only, hey, like what are you doing? What's like your lifestyle, but how are you mentally? What's happening emotionally? What's happening spiritually here? And putting all these things together and knowing that all of these things impact total health. So we also want to look at, depending on the condition that we're looking at. So like maybe you were fine up until your 20s and you had no GI concerns, and then something happened and you just started having terrible, terrible stomach issues. Well, we want to go and figure out like, well, why did that happen? What changed? And so we want to dive into your life like very, very deep. I've worked with some adult patients where we're going back to their birth, like what was your route of birth? What was your method of feeding? Were you breastfed? Were you formula fed? Like going through all of these things and trying to really get to the root cause, correct any deficiencies or anything that maybe has just kind of gone by the wayside and up until how you got into your condition that you were today. All right, so I think the big question for everybody is like, when do I need to see a dietitian? I know that a lot of people, you can see, you're like, wow, I wish that you would eat healthier. And those are definitely good, like general healthy eating advice, good reason to see a dietitian if that's not something you're feeling confident in. But also, I think we all know, like fruits and vegetables are good for you. And if you can tell someone that they should eat more fruits and vegetables, then that's also totally fine if they can then do it. So if you're telling, and so that's where we would kind of switch, like maybe you've been trying to help someone eat healthier, but we're really struggling with the execution piece of something, that would be a good time to go see a dietitian. So we can help develop supports and use some nutrition counseling skills to really help people find what's going to work for them specifically. Some other reasons you might want to send a client or a family member to see a dietitian would be diabetes and prediabetes, and coming up with good solutions and choosing low carb foods to help manage those things. We can look at a lot of things that are prepackaged and like, how can we make nutrition for you more accessible? Heart disease or having just some wonky labs there. If, maybe the only solution offered to you, which life-saving, some medications for your cholesterol, great, we love it, but what's causing that? And so we can dive in a little bit deeper on that if someone is interested in, hey, I actually do want to make some healthy changes here and see what I can do to protect my heart. Same thing with weight. And then some other maybe less common things that we think about a dietitian can help you with, even in getting to the root cause. GI docs are amazing, and depending on where you go, you'll have access to GI dietitians there as well, and you can always request that. I know dietitians aren't necessarily included in like every single visit, but they're always available at your hospitals. So if you're working with, Children's Mercy, for example, you might be going to GI clinic and maybe you haven't seen a dietitian yet, but if you're thinking that, hey, I do think something they're eating might be causing this, then you can ask, and they typically have like a dietitian on call there to help with their GI clinics. Yeah, and then even mental health, I think that would be mental health and behaviors are the two things that get overlooked the most when it comes to seeing the benefit of nutrition and helping with these things. We already talked about anxiety and depression. Those have some serious micronutrient consequences and impacts there. So we can work on those things. It can be a two-way street here as well. The food that you're eating can impact your mental health, but also your mental health can impact the food that you're eating. And we really need to figure out where's this spiral happening in this vicious circle. With mood swings, a lot of times when we're malnourished or we're not eating on the right schedule or we're not eating the right kinds of foods at the right times during the day, that can kind of create mood swings and aggressive behaviors, and all just because maybe our blood sugar's tanked and we just need to have a snack. So working with someone to really figure out, hey, what's going on in my client or my kiddo's life that we could really kind of work on. And then there's all sorts of things that we can, look at the behaviors around autism and ADHD. We can look deeper into picky eating, maybe poor appetite, better focus, more stable moods throughout the day that are all kind of tied into those things. Okay, so how to prepare for a nutrition visit. I think I'm most excited to present on this because if you've never gone to see a dietitian before, it's a lot. So when you're going in to your nutrition visit, having a list, even if you're working with your client or your family member that you're taking to see a dietitian, sitting down with them and talking about, okay, what do you want to get out of this entire process? So what is your health goal? And so we want to look really closely at that. And there's a couple of charting the life course tools that I really like that I'll even use with teens and stuff that I work with to kind of help them figure out hey, why are we doing this? Getting clear on your goals also helps the person going to see the dietitian really kind of get that buy-in and figure out okay, I'm doing this for a reason. I'm doing this for myself. It's not just for someone to tell me what to eat. And we also need to get clear on what do we want from our dietitian? So this kind of circles back, are you looking for someone who's going to counsel you on a low carb, high fat diet? Are you looking for someone who does have that integrative background? So what do you want to walk away with? And especially in that first session, because we're taking in a lot of information and we're kind of figuring out what the situation is, having a clear actionable step, when I leave this appointment today, I want to have this piece of information with me or a tool to execute this particular goal, because weight loss is a really long-term goal. We wouldn't expect that to happen in, 1 month or even maybe 6 months. We're going to be working together for a long time. So as you leave this first appointment, what's that one thing that you need today? And then also being able to communicate that with your dietitian is really helpful. And then, want to make sure and check in with being realistic with our expectations and open to new ideas. A lot of times I'll have families come in and they'll sit down and, picky eating is a great example. They'll say, oh, we want, to expand their diet. They're a picky eater. And it's okay, well, we can try from all the things that you've told me, we can try this, this, and this. And they're oh, well, we've tried that, and that. And I'm okay, but how long did you try it? Did we, try different foods? So we really have to dive in a lot deeper, even if you feel you've already tried something, or even if you feel you've tried everything. I'll often have people come in saying, I've tried everything to get them to eat one different thing. And, we'll kind of run through, well, hey, what have you tried? And it's only like maybe two strategies when there's a whole host of different options that we can try and implement for their kiddo, which is why they come to the dietitian, and why you want to work with someone is so you get new ideas and new strategies. So just being open and flexible and having that expectation of like learning, and no one's telling you what to do. I always like to throw out suggestions, and normally I have maybe a list of 3 to 5 things that I think would be helpful. And I'll just let the families pick what thing that they're most interested in trying that's going to work for them. So kind of be prepared to make some decisions. And also it's okay to take some time and think about what you're really wanting. And then when you leave the dietitian's office, it's a little bit different than when you leave, your doctor's office. Maybe you leave your doctor's office and you go to the pharmacy and you fill your prescription. Great, you take your medicine and you're done and it's good. When you leave the dietitian's office, you have to be, you're kind of expected to put in a lot of work every single day to build new habits and behaviors with the tools that you've got. So trying to be aware of that and like, how is this going to fit into my life? And what capacity do I have to make these nutrition changes? And then also sharing that with your dietitian so they know where you're at and how much change you're looking for, and how many solutions and strategies and our capacity to make those changes and what that is. All right, so one of the things I like to do with kids, or really anyone who has a developmental disability, or is like even adults that are looking to just totally optimize their health, even if they don't have a developmental disability, looking at like, what are these things that you want out of your life? And not necessarily just out of your health, but like, what are your goals in life? And then what are these things that you're really worried about, that are weighing on you, that you really don't want to be a part of your life, that maybe cause you extra stress? And I look at the entire life, because it kind of goes back to that IFM model that we were talking about, because I want to know those things that are causing you stress. I want to be able to tell you, these nutrition strategies for you are going to help you execute like X, Y, and Z. And I want to be a part of you reaching your goals and your journey there. So I think it's really important to kind of like unpack just like totally what are we doing? Maybe you want to lose weight so you can hang out with your friends more. Maybe you want to eat a wider variety of foods so you can actually go out to a restaurant and enjoy time with people. Or maybe you want to go out to a restaurant, but you don't actually want to eat the foods that they serve there. And that's okay too. And we can work on different strategies and solutions and finding, foods that are acceptable for you at restaurants, so you can be social and go out with your friends. So I think this can also be a tool for anybody to help their loved one or their client really figure out what are your goals with nutrition and health, and where are we going? So what to expect during a nutrition visit. I think that this is really helpful for individuals with developmental disabilities, because or families with kids who are bringing in, their child who maybe does not have the capacity to set through a super long visit, because our visits are really long. And it can be really anyone. The visits are they're just long, regardless of if you have a developmental disability or not. So just be prepared for that, and advocate for, the needs of yourself. If you have any time constraints, and really paying attention to like what's going to be best to get the most out of your visit. So first off, there's going to be a lot of questions, and they all are obviously going to focus on like what you're eating. And it can kind of feel like even just a question on what did you eat for breakfast, when maybe you had like 8 pieces of French toast with whipped cream on top. It's fine. It's okay. You can say like, oh, I normally have for breakfast this, but yesterday I had this. And we want to know all of those things. And there's really no judgment in what you're actually eating. We just need to know, so we know where we can start working together. So here are some examples of questions that would be asked in your nutrition visit, and they will all probably have follow-up questions to them. So like on portion sizes, did you eat the size of, like, was it 6 servings? And you're like, I don't know what a serving is. Totally fine. How many fists of green beans did you have? How many handfuls of lettuce? How many bowlfuls of goldfish, it doesn't really matter, but there's just so many questions and it can be kind of an exhausting visit. Depending on the kind of dietitian you see, visits are anywhere from 15 minutes to an hour. All of my initial visits are at least an hour, and sometimes they go to like 75 minutes. So it's long. Lucky for me though, I pretty much mostly talk to the parents and their telehealth visits. So kids are at home and they can do their own thing. But imagine, taking your child in to the doctor's office, you had to wait there, you had to get checked in, you had to wait in the room a little bit longer for your provider to come in, and then you're going to spend a whole hour talking to somebody about what, foods they eat. It's a very long visit. So if that's not going to work for you, if you're going someplace, like if you were going to a children's hospital, you could definitely ask for a child life specialist to attend that, to kind of help manage, your child's behaviors, and just like the time that they're spending there, occupy them. They always bring toys and have some fun things for them to do. So that can be really helpful. Or if you're just kind of like, look, we only have 30 minutes for this, or we only have 15 minutes, making that really clear to your dietitian or whoever's checking you in, like, we are only going to have this much time for this appointment, and that is totally fine. When it's actually better if it's communicated. A lot of times I'll have kids come in and, we're in like a really small room and it's a lot, there's like a lot of questions. It doesn't necessarily feel good to answer all the questions that you have to ask. And we only have 15 minutes. And so if I, before kind of everything just goes a little bit haywire. So if I know that we have 15 minutes, I'll just kind of cut right to the point and we'll just dive in on some goals there versus doing that really long assessment. Weight is always a really big topic around nutrition. I feel like a lot of individuals with developmental disabilities do have some sort of weight issue that they want to work on, whether that's too much weight or not enough weight, but we can kind of dive into that a little bit. So I feel like it's either one or the other. We either have like really high weight or we have really low weight, and making weight loss goals is not necessarily the most helpful thing for really anybody. There's a lot of physiological differences depending on what the developmental disability is. So it might be incredibly challenging to lose weight for some people. It might be incredibly challenging to lose or to gain weight for some people. And so we want to be really respectful of those, those challenges, and setting weight goals. It can really prevent someone from feeling motivated and actually reaching their health outcome. So instead, we want to make sure that we're making like lifestyle goals and not weight loss goals, and that we're really tracking people's labs, and that we know, hey, biochemically, everything is looking good regardless of what your weight is. So I can tell that you made progress in dietary changes because your cholesterol is down, even though your weight didn't change as much as you wanted it to. Or, wow, you have so much more energy now, even though your weight didn't necessarily change. Or like simple lifestyle goals that like I like to make, especially with like kids who are maybe actively like trying to lose weight. It's not necessarily like how much weight did you lose, but did you hit your goal? So did we eat a vegetable every single day? How much water did we drink? Like, did we hit our water goal? And so we can make goals around those things instead of that weight goal. And typically you'll get a lot further with those things too. So even as like you're speaking with clients or your own family members about kind of some strategies that they could use to maybe help themselves out, instead of focusing on that weight loss side of things, encouraging someone to drink a certain amount of water is more helpful. So when we're looking at family-centered and patient-centered care, I think the biggest thing is to remember that health is a choice. So you might have, from what we've covered, you might think, oh, hey, I do have someone that I really want to see a dietitian. But the biggest question is, do they want to see a dietitian? So I'm always under the philosophy that health is a choice as long as people have access to it, because a lot of people don't have access to those things that they need, even though they would like them. But if someone has access to a dietitian, they're not obligated to use it. Maybe someone does have a higher weight. They're not obligated to lose that weight. They can use other methods, and that is totally fine. And so just being aware of that. Maybe you give some nutrition visits a shot, and it's like, you know what, this just really isn't for me. This doesn't align with the lifestyle that I want to live. And that's totally okay. So when kind of putting together your recommendations on, do I need to see a dietitian or not, really take into account, that person's perspective on if they're going to find value from that, if they're wanting to live that healthier lifestyle, or if they're content with where they are. It is also, we don't want to totally overwhelm people with additional providers either if they're not invested in that method of care. So a lot of my kids have, 6, 8, 10 different providers that they work with. And basically parents are, that's their full-time job, is managing their child's providers and their child's case, in addition to having a case manager and all these things and trying to manage it. So if nutrition isn't the priority in the moment, then it's not necessarily something that needs to happen, if that makes sense. So just being really respectful of people's time. And, if I have people that I see every month, but maybe they're seeing 25 other people, in the next 3 months, I could say, hey, it's totally fine. Like, you have a lot going on that you're trying to figure out. Here are some really specific solutions for us. And then we can touch base in 3 months instead of meeting every month. So that way you have a little bit of extra space to breathe. Looking at, as far as providing interventions to people, looking at exactly what the family needs and what the family dynamic is and what the child needs and what the child wants. That is really important to make sure that we're not just giving cookie cutter interventions like, hey, you need to eat more vegetables, good luck. If you're a picky eater, we want to dive in, what are your sensory needs? Do you need convenience items? Do you have time to make anything from scratch? Do we need to just figure out how we can eat at Chick-fil-A and not just Wendy's? What do we need here, and providing solutions that meet those needs. Also looking at that provider overlap can be really helpful in managing how many people a person is seeing, and if those visits can be combined. So I will often see kids with either their SLP or their OT just during our visit, and it's really nice. It cuts out on one extra visit for the family. We both get all the information that we need, and it's great. Or maybe I'll have a child that's being seen by GI and their nutrition needs are being met by GI, and they have all of that. So then maybe they don't need to see me, or they don't need to see me as frequently if they're getting extra things from another provider. So my goal is really just to streamline care, and I will take in a lot of information from how other providers that people have been seeing, and then try and put that all together in the context of, how can we use all those things and put it together in, or use those interventions that other people have been recommending to you to then just add that into nutrition. So if people have supports that are working in one area of their life, then let's just take that and apply it to nutrition. All right, so I want to just cover a few nutrition basics so we know what to look for to further identify if someone would benefit from nutrition care. So we'll just dive in a little bit deeper on an overview of nutrition. We don't really get into any specialty diets that people might benefit from, because nutrition is such a vast topic, and this is a very wide variety of people here. It's hard to kind of pinpoint, hey, we need to talk about this, one nutrition solution for this one specific thing. It gets a bit dicey, and I want everybody to have value from this. So we're just going to talk about the basics. And if you have more specific questions, you can ask those at the end. So my nutrition hierarchy is first focusing on the feeding behaviors. Then we want to make sure, so once we have all of that kind of straightened out and we have what we would consider, really good nutrition behaviors and a really great relationship with food and that meal times, we have a good schedule, and we'll tackle all those things in detail in just a second. Then we'll move on to our macronutrients. So are you getting enough protein? Are you getting enough carbs? Are you getting enough fats? And diving into that. And then once because those are those things that are going to promote growth. And then we want to do our variety and quality of our diet, which is at the very top and the last thing we address, because we can typically fill in any gaps with, vitamins and other supplements and things like that. But if getting an additional variety into your day-to-day is important to you, that's kind of that last piece, because the feeding behaviors and the macronutrients both make it easier for you to address the quality and variety of diet issue. So feeding behaviors are really prevalent in kids with developmental disabilities. So we want to make sure that we're catching the right people. I have a lot of, I'll end up seeing some people that, the maybe parent thinks that they have some sort of feeding difficulty or feeding behavior, but they don't necessarily. And so you can see that on this little chart from this research paper that there are misperceived feeding problems. And that's totally fine. I think it's better to see someone than to not see someone and figure out like, hey, your kid's doing great. Let's go ahead and keep doing what you're doing. And you can try these 2 or 3 things to just really improve that. And then we have some feeding difficulties. So, feeding difficulties would be more like that kind of, basic picky eating. That would be a feeding difficulty. And then feeding disorders would be something that is a little bit more innate or an actual like diagnosable problem. So one of those things kind of as it would progress with picky eating would be something called ARFID, which is avoidant restrictive feeding intake disorder, which is where there's more of like this fear and insane anxiety around eating food. And so then that falls into that feeding disorders category. And as we go through each of these areas, we need a higher level of care and probably more specialized care. So our basic feeding behaviors, what we want to look at are all these things here on the left. And we really want to limit all of those things. And so I think the most common thing and the thing that makes the biggest impact is eliminating grazing. And so what grazing is basically it's, oh, I'm going to have a couple goldfish like this 30 minutes. Okay, now I'm going to have a cheese stick the next 30 minutes. Oh, we're going to have some dry cereal, after that. And it's kind of just a constant stream of food intake throughout the day. That throws kids off for a lot of different reasons. It throws adults off for a lot of different reasons. And we want to make sure that we have some really set meal times and that those meal times are really impactful and they're really focused on the food or whatever nutrition intervention we're applying here. So we want to have 3 meals, and this is specific for kids. If we're having weight problems, we might tweak this a little bit, but at its baseline for anyone across the board, if you notice that this is not maybe aligning with what they're doing, then that would be a good time to go speak with a dietitian or a nutrition professional. So we want to have 3 meals and then 2 to 3 snacks a day if snacks are needed. And the snack should be less than 15 minutes. And our meals, we want to be no more than 30 minutes. So if we're sitting at the table, for 45 minutes, constantly prompting to eat, we're actually kind of like backsliding rather than making progress in our nutrition goals. So depending on what your child needs, if they thrive with timers, if they don't, sometimes it can be helpful to set a timer and see where they're at. And then going on from there. And there's, a host of different feeding interventions and supports that we could look at if we're not necessarily meeting these goals. So for meal composition, we want to make sure that we have a good variety of protein, carbs, and fats. I know we don't normally think of our food in that way as like protein, carbs, and fats. We think of it as, grains, vegetables. We do think about protein most of the time, and fruits, and then we have dairy. So we want to shift that from those 5 food groups to our macronutrients: protein, carbs, fats. Protein, they're the building blocks. They build our muscles. They're core for like our enzymes so we can digest things. Pretty much our body runs on protein for function. And then carbs are our fast energy. So during sports, we want to make sure that we have a lot of carbs and fast energy. Kids growing, they need a lot of carbs and that fast energy to kind of keep their energy up. And then fat, that's more of our slow energy, so it kind of keeps us sustained. our body will use that over longer periods of time. So if we're not constantly grazing on food, we want to be tapping into that, to using fat as energy. So here are some examples of proteins, just so we can kind of put that into perspective on what we'd be looking for. I typically give people handouts with the different like macronutrient breakdowns. So there's a list of proteins, there's a list of carbs, and there's a list of fats, because we want to make sure, next page, we want to make sure that we're putting foods together right to keep our energy up, to prevent mood swings, to prevent meltdowns. We want to make sure that the composition is ideal for just that more sustained mood throughout the day. So for our snacks, we want to have a carb, which could be a veggie, a fruit, or a grain with a protein. And then for our meals, we want to have some protein, carbs, and fats. So the carbs could be from like starchy veggies, they could be from some grains. We want to make sure that we have a variety of, fruits and vegetables if your kid likes those things. If they don't, that is something that we would like to work on. But when we're doing snacks, and I think that's one of the most impactful things for people outside of eliminating grazing, is making sure that there's a protein or a fat with the carb. Our snacks are just typically carbs. So when you add that protein or fat, it's going to help you feel more full, and it's going to take you from the snack time to the next meal time. It's also going to help keep your blood sugar a little bit more stable, and it's going to, in adults, it can help prevent insulin resistance. So for diet quality, there's a couple different things we can do here. Ultimately, the goal for everybody, even adults, is increased diet variety. The more variety you have, the better your body thrives. So not only do you get a variety of nutrients, it actually helps you build a better gut microbiome, which we have that gut-brain axis, and it makes everything better. So we have some options to increase diet variety. This works well in picky eaters, and it works even better if your child's not a picky eater and you're just trying to get them to increase their variety. But food chaining is the kind of the process of offering a food that's really similar. So it's like an adjacent food to something that's already accepted. So for instance, if your child likes chips and that's like a really safe food for them, then what is something that's like flat, crunchy, and salty that we could offer that would be different than the chip that they like, but something that they might accept and meet their sensory needs? And then also examples of what that would look like. Can we switch from chips to crackers? There's a brand of chips that they're made out of chicken, but they're flat and crunchy and salty, just like a regular chip. So could we switch to that? And kind of working through that until we can get to a new, different food, and a new texture and a new flavor. And we just want to change things very slowly. The other method that we have for increasing food variety and quality is using sensory progressions. So sensory sensitivities or sensory seeking behavior is really common in developmental disabilities. So we want to look at how can we do safe sensory exposures that, they're not super triggering. It's gentle, but it helps us build our confidence with new sensory inputs. So we want to start with, it's totally fine. You don't have to eat that food, but can you just touch it? And maybe that touching is with a fork, and that's okay. Well, we just want to get comfortable. Any food exposure is a good exposure.
Breta, it's Stephanie. And sorry, this is another area. Matthew just downright refuses to try new things. He is so picky. I mean, I am too, but he is extremely picky. So have you had, and I hate to ask this question this way, but have you had failure with kiddos before? I mean,
yeah.
So how do you really get somebody who is, on the spectrum, and I'm sure other individuals with intellectual and developmental disabilities are the same way, but I only have the experience at home of autism that will shut down and not eat anything if you don't give them what they want. So how do you do those little changes? I didn't know when you just said the chip and the chicken, I'm like,
yeah,
I got to hear more about this, because he actually likes chicken. So I could get those
Yeah.
chicken chips instead of chips.
Yes. Yeah. So one thing is kind of being, having someone who's either really well versed in like a variety of different food products, or going to the store and like trial and error. It can be kind of expensive to do that, but it is a lot. Like, okay, I'm in the chip aisle. What would maybe be a better option of chip? And just kind of like slowly doing those things if you're going to do it on your own. But if you have someone that it's really frustrating and anxiety inducing for them to be presented with new foods, then we're not going to eat the food, and we're not going to do it at a table. We're taking it out of that context and out of that situation, and we're going to experience the food in a new and a different way. So sometimes that's like sensory bins. If your kiddo's like really good at sorting, or they're learning how to sort things, you can put, 4 different kinds of pasta on like a tray and have them sort out the different kinds of pasta. So we're getting that exposure to a food in a way that's not necessarily like where there's no expectation of eating and it's not associated with eating. So those are some like things that I'll do to kind of figure out where are we at with our ability or our desire to be exposed to new foods, and how can we find like a safe space for someone to experience that.
So this brought up a question. Is there a danger of causing more pickiness by doing food chaining? And then there's another one too, but I'll go ahead and let you answer this first part first.
Yeah, sometimes kids do have regressions, and that it is a bummer, but I think what you'll find, even if you're not food chaining, they're going to get bored of like the 3 foods that they like eventually, and then you might be losing foods too. I also, if it's not something that is important to them, and it's really hard with kids, we have to like walk a fine line of that like self-determination and consent. But if you're an adult and you don't love like eating, you don't love trying new foods, that's okay. We have people who they have they can't eat anything. They only ever use a G tube, and they get all of their formula or like all of their nutrition through a specialized formula. So technically we can do that for an adult and make sure that they're, well nourished, and there's something that they can drink, and then boom, done. We know that they're getting all their micronutrients. If volume isn't an issue, making sure that taking a vitamin, that's really helpful. And we really can't force people into eating things that they don't want to. So being respectful of that for people, and knowing that if that's not a goal of theirs, then it's maybe just not something that's going to happen, especially if they're an adult and are already have already made that choice for themselves.
I have to laugh because after 26 years, he has not gotten tired of the 3 meals that he loves to eat.
Well, good. I'm glad those are his staples.
No, that's not good, because it's cheeseburgers, pizza, and I don't remember, spaghetti or something like that. But all the carbs. What is an approximate timeline that it might take that you would work with someone on this? Like, and I'm going to kind of expand on this question, but like, where do you say enough's enough? It's not going to work.
Yeah. It kind of depends on the family and how much progress we've seen or not seen, and really what the family is able to implement. But life is hard. Like, I mean, that's just, and also, trying to work on feeding is incredibly challenging, and it takes a lot of commitment and dedication. So, if I was seeing someone every 6 months, or not every 6 months, every month for 6 months, and every time it's like, oh, I just haven't been able to even try that. I haven't been able to try that. Then that's kind of like, maybe this isn't something that's like super important to you right now, and that's totally okay. Like, let's put a pause on it. If there's a time where it is important to you, like, let me know and we'll get back to it. If they have been trying and getting absolutely no results, that's probably going to come about on like a year if we're meeting every month, if we're meeting, but I would guess that in that time we would have seen some progress. and that's the big caveat. It would have to be absolutely no progress. But if we've been able to maybe start doing cooking, great. If we've been able to start doing any interaction with food, like, hey, we're okay with the new food being on our plate now, great. Like that's a big win too. So it really depends on what was the progress. And sometimes things don't feel like progress to families, but in seeing where they started and where they are now, there was progress happening there.
Yeah, the progress we've gotten is from 6-7 sodas down to 1 soda a day. So
that's great.
That was a win after probably 20 years. So
yeah,
okay.
totally.
That's all the questions that
Okay.
are right now.
Awesome. So what is the perfect diet? I think that's a big question that a lot of people have. And again, it depends. What are the health concerns that we're seeing from somebody? What does their blood work look like? What's their ideal lifestyle? What's the lifestyle they want to maintain? And what supports do they have access to? So all of that would inform the perfect diet. Maybe you did want to do a low carb diet, but if you don't have access to low carb foods, if you don't have access to someone to help you make those decisions or to learn about those things, then that's maybe not for you. So and that's totally okay, and we can work with that. And supplements can be incredibly helpful. And I use supplements with a lot of kids, but it's something that you want to be careful and diligent about on doing it on your own. So supplements are not a regulated industry, which at the end of the day, it's okay. There's a lot of safe supplements out there, and it's not like you should be scared or like stray away from using any supplements, but you do want to make sure that you always disclose any supplements you're using to your like physician or anyone providing care to you, because they do interact with medications a lot of times, and we want to make sure that you're being safe and that you're getting the appropriate care that you need. They also can have side effects. So for instance, I told my dad, he was having some like muscle cramps, and I'm like, oh, Dad, you should just take some magnesium. Great. He was like, awesome, I'll take some magnesium. And then he took 300 milligrams of magnesium, because that's how it comes at the store. He just like bought one of the bottles off the store and, took one. They're out for a hike, but magnesium is also a laxative, especially if you take it in that 300 milligram dose. And so like did not end up being a good situation for the leg cramps, because we got like the wrong side effect, because the one that you buy at the store in that dose, and most people are buying it for the laxative effect. So we want to just be careful. There are side effects, even if something is generally safe. We also want to make sure that we're being aware that oral nutrition supplements are a form of nutrition, and that can be a form of nutrition care and medical nutrition therapy. So, maybe we do have such a limited diet and such a limited volume of food that we're eating. It's definitely okay to use a nutrition supplement like Ensure, Pediasure. There's like a million different things you can have that meet your specific nutrition needs, to make sure that we're getting protein, calories, and nutrients while we're working on expanding someone's diet. Or maybe that is just going to be the way that you get your nutrition, depending on what the individual decides. We can use supplements to help manage a variety of things. All of these things on the end, I'd say for mental health, supplements are incredibly helpful and impactful. Not every provider is comfortable recommending you supplements. So if that's something that you're wanting to explore, you want to make sure you're asking those questions of the person you're choosing to work with. We already talked about the adverse effects. And the other thing would be making sure that if your child's on medications like we talked about. So a lot of kids use an off-label medication that's just most kids' medicines are not actually tested for the thing that they're using for, that there's like some side effect, and we're like, oh, it solves this problem in children, and so that's what they're using it for. So we just want to be sure that the off-label use is compatible with whatever supplements you want to use. So to help manage sleep, a lot of kids get put on a medication called clonidine, which actually lowers your blood pressure. So again, like if you were going to add magnesium can also lower your blood pressure. But if you're on a really high dose of the clonidine to help with sleep, then magnesium would be contraindicated in those situations. So just some examples of how we want to be really diligent about that, especially when medications are involved. And then at the end of the day, we want to leverage supports. Everybody uses supports. Just anything that makes your life easier and more effective can be a support. So for me, I lose my keys all the time. And then I waste so much time like looking for my keys, unless I have a very specific spot that they go. And every day I walk in, I hang my keys up and then they're always there. If I miss that step, then I'm never finding my keys again. So just like paying attention to those things. A calendar as your support is like a really good example. If it's not on my Google Calendar, it's probably not going to happen. So just knowing yourself and walking through those things with other people. Using visual schedules is really helpful for me in my practice and helping kids, transition into meal times and out of meal times. And if they thrive with a visual schedule, then how can we apply that to other things? Maybe we need pictures of all the foods and then they get to pick their meal. Having, tools for people who are non-speaking can be incredibly helpful so that they feel like they have control and empower them to make their own food choices and pick those things. That's something that is really common with picky eaters, especially when they're non-speaking, is that they're really striving for any control because no one is communicating with them the way that they want to be communicated with. So if we can overcome some of those barriers by putting in the right supports, then a lot of times it will solve just outside problems that you didn't think it would solve. Awesome. And that's the end. So if you guys have additional questions, please let me know.
Before questions, I just want to share, and we just go back one, Breta, the Charting the Life course tools. If you haven't heard about them in the past, they actually were developed by a group out of Missouri at the University of Missouri, Kansas City. The UCED there, which is the University Centers on Excellence in Developmental Disabilities, Dr. Shelley Reynolds and her group have really, along with a whole community of practice across the country, have really worked on these life course tools. And you can find them at lifecoursetools.com. Not only are there these tools that she showed you today of the trajectory and the star, but there's also booklets of different life stages that you can think about. What questions are you thinking about? If you're thinking about transition or adulthood or young childhood, there's lots of great information over there. It's again lifecoursetools.com. And people use them for all kinds of things. As I once said when I first learned about these, as a child and product of the 80s, where I had a dream board made up of all of my magazine cutouts, this is that with a roadmap. So it was really exciting for me because you can put a roadmap to it. So I will stop about that. I just wanted to let you know where you could find these, find that more information on that. Does anybody have any questions for Breta? There was a comment. This was great information, good information. Thank you, Breta. So good to see you. That was from Colleen. So we were supposed to do this back in June, and unfortunately I had a family issue. So I'm glad we were able to get this rescheduled.
Yeah, thank you guys for having me. I hope there was some valuable information in there for you, or just something to reflect back on when you guys have the slides as you're, participating in nutrition care. So thank you guys so much. And you can always find me, feel free to email me if you have questions, or my website is nourishedtogether.com. And there's a lot of information there on like nutrition and for autism.
One other plug that a couple other plugs that I need to do. KCART will be doing their annual Autism Across the Lifespan conference coming up April 8th. It's a Friday. It will be at Edwards campus in Overland Park. And it's going to be a smaller version of what they've done in the past just because of COVID practices. So watch for that information that will be coming out soon. And next month we will be talking about, hopefully we haven't figured this all out yet, but next month we'll be talking about autism and developmental disabilities and around race. And then in March, we hope to have some summer camp information coming. So those are some upcoming things. Is there any other questions? No? Well, we'll give you some time back tonight, and thank you for joining us. We appreciate you.
Thanks, everybody. Have a good